Healthcare is fundamentally a human experience. It is one person skilled in the art of healing, helping another person on their own unique road to recovery. So which aspects of healthcare as a service, are most important to prioritize when considering or evaluating tech solutions for common problems in the process of care? I think the big one here is really to understand that healthcare, and I mentioned this in the book, Better Outcomes, A Guide to Humanizing Healthcare, but healthcare is fundamentally a human experience. It is one person skilled in the art of healing, helping another person on their own unique road to recovery. So that's kind of the baseline. That's where I'm tackling this from. If you take that viewpoint that healthcare is a human experience, then when we're considering some kind of tech solution, maybe it's to streamline intake, maybe it's to provide more transparency throughout the healthcare process, maybe it's to enable clinicians to document more efficiently. Whatever the case may be, we need to understand that, or we need to use the guidepost of this healthcare, this experience should be a human experience. So whenever we implement a technology or a platform or a device, the end goal should be greater access, greater human connection rather than more abstraction. What I mean by that is, if we're going to implement a digital patient intake, for example, or some kind of asynchronous communication method with patients, we want to make sure that at the end of the day, it's not like a chat bot or check boxes, that we make it very clear to the patient that is going to be going through this process that this tool, this software is allowing you to have more of a real connection and relationship with your clinician than you would not otherwise have if you were just filling out your paperwork in the clinic, for example, or something like that. If you by taking the time to complete this digital intake that's going to be emailed to you that you can fill out on your phone or your laptop or whatever, when you come into the clinic, we can spend less time with that administrative paperwork and your clinician, and you are going to be able to spend more face-to-face time to build that relationship so they can understand what's going on with you and then better develop a plan of care with you. Instead of just filling out a bunch of paperwork, moving through the motions, and having less time with your clinician. So everything we do when implementing or considering technology and tech solutions in healthcare should be with this mindset of how is this going to add to and promote human connection. And the negative side of that would be, how can we avoid implementing a tech solution and having it become a more abstract process rather than a human relationship building outcome.